Did you know that 12.94 billion doses of the COVID-19 vaccine have been administered globally, and around 1 million are now administered each day? Well, on October 20th, 2022, the CDC voted to add the coronavirus vaccine to the schedule of recommended vaccines for children and adults. However, only California and DC have announced that the intent to require the COVID-19 vaccine, and both will require only fully FDA-approved coronavirus vaccines for the recommended age groups. School vaccination requirements help safeguard children and adolescents by making sure they are protected when they get to school, where potential for vaccine-preventable disease transmission is higher. Vaccinations should be required for all children before enrolling in school. First, I will talk about how vaccines can save children's lives. Then I will discuss how major medical organizations state that the ingredients used in vaccines are safe. And finally, I will look at how vaccines protect the herd. First, let's get into how vaccines can save children's lives. First, the COVID-19 vaccine prevents individuals from getting the disease, and second, it creates childhood immunization. The American Academy of Pediatrics states that most childhood vaccines are 90 to 99% effective in preventing disease. According to Shot at Life, a United Nations Foundation partner organization, vaccines save 2.5 million children from preventable diseases every year, which equates to roughly 285 children saved every hour. The CDC estimated that childhood immunization prevented about 419 illnesses, 26.8 million hospitalizations, and around 936,000 early deaths of children born between 1994 and 2018. The measles vaccine has decreased childhood deaths from measles by 74%. And so after examining how vaccines can save children's lives, we can take a look at how major medical organizations state that the ingredients used in vaccines are safe. First, the amounts for the ingredients used in the vaccine are safe, and second, major medical organizations state that vaccines are safe. Ingredients such as thimerosal, formaldehyde, and aluminum can be harmful in large doses, but they are not used in harmful quantities in vaccines. Children are exposed to more aluminum in breast milk and infant formula than they are exposed to in vaccines. Paul Offit, MD, notes that children are exposed to more bacteria, viruses, toxins, and other harmful substances in one day of normal activity than they are in viruses. The FDA requires up to 10 or more years of testing for all vaccines before they are licensed, and then they are monitored by the CDC and the FDA to make sure the vaccines and the ingredients used in the vaccine are safe. Major medical organizations such as the FDA, IOM, AMA, AAP, UNICEF, HHS, and WHO all state that the vaccinations are safe. The U.S. Department of Health and Human Services states vaccines are some of the safest medical products available. And now that we understand how major medical organizations state that the ingredients used in vaccines are safe, we can discuss how vaccines protect the herd. First, vaccinating young children creates community immunity, and second, vaccines protect future generations. Herd immunity, or community immunity, means that when a critical portion of a population is vaccinated against a contagious disease, it is unlikely that an outbreak of the disease will occur, so most members of the community will be protected. Children and adults who cannot be vaccinated due to age, poor health, who are immune compromised or undergoing chemotherapy, for example, or other reasons, rely on herd immunity to prevent contraction of vaccine-preventable diseases. For example, in 2005, an 18-month Amish girl contracted polio and spread the disease to 4 other unvaccinated children, but because the community met the herd immunity threshold for the disease, there was no polio outbreak. Vaccinated mothers protect their unborn children from viruses that could potentially cause birth defects, and vaccinated communities can help eradicate diseases for future generations. Before the rubella vaccine was licensed in 1969, a global rubella, aka German measles, outbreak caused the death of 11,000 babies and birth defects in 20,000 babies. Women who were vaccinated as children against rubella have greatly decreased the chance of passing the virus to their unborn or newborn children, eliminating the birth defects, such as heart problems and hearing and vision loss associated with the disease. Proponents say that the vaccination is safe and one of the greatest health developments of the 20th century. Dozens of illnesses are now prevented by vaccination, and millions of children's lives are saved. First, I talked about how vaccines can save children's lives. Then I looked at how major medical organizations state that the ingredients used in the vaccine are safe. And finally, I discussed how vaccines protect the herd. It is clear that vaccinations should be required for all children before enrolling in school. Just remember that vaccines are the small steps needed to protect our community. Let's all do our part. Thank you.